Hey guys, down here. Welcome to the $1,000,000 Minute. So, the funny thing is, I said yesterday I was going to stop. I kind of find it hard to stop when I have it kind of rolling. So I might certain days not do it, but for now, I think I'm more in the habit of doing it than not in the habit of doing it. So I'm going to go through this day. First patient, 68-year-old, he had a 5th met bursa, and so we did cortisone number 2 on this. He did one a few months ago, came back. It's kind of large. We talked about surgically removing the bursa. We also talked about doing some shockwave. I find sometimes that shockwave works well. I had another patient with one on the 5th met head, and it really resolved it. Next patient was a 98-year-old that had a hammer toe. He had a painful callus on top. He's actually a routine patient, but he came in because his hammer toe, or the callus. So this was maybe my lowest value patient of the day. Next patient was number 6, shockwave. Now for this patient, I did a 3-month follow-up, and the reason for that is we originally did 3 sessions, then 6 weeks, and another 3 sessions, and I'm going to do 3 months because I think it's going to just need more time. Next was a post-op patient. She had an exostectomy on the 5th digit. Originally she came back in and put her on an antibiotic. There was a little bit of redness around that. The area, not so much of the incision to hist, but it's mostly where I ground down with a rasp, and I think I stretched the skin a lot, so there's a little bit of a sore there, so she's going to keep it covered for another week or so. She's going to follow up as needed. Next patient was a new patient that had hallux limitus, and so we did bilateral x-rays, and this patient got orthotics, so that would probably be one of the MVPs of the day. Next patient was a shockwave number 3 out of 6. Did orthotic dispensing this day, and then she has a few more. Next was Qenza number 1 on a patient, so we periodically do Qenzas. They're nice because you don't have to do too much. Really doesn't take hardly any time for me just to slap it on, and then my staff kind of takes it off. Next was a matrix follow-up. This was maybe another low-value patient. I've tried to not have these ones come back. I use sodium hydroxide, and sometimes they get really, really swollen and red. So I'm thinking, for some patients, I might have to have them come back. So I'm trying to figure out a way I can double book these with other patients, so it's not such a poor use of that slot. Next patient was a new patient. He had an ankle sprain, so we got X-rays, and we put him in an ankle brace. He was previously seen in urgent care, so this is one case where we probably lost out on this one because they went somewhere else, got X-rays, got a cam boot, and then came to see us. I would prefer that not to happen. I would prefer them to come directly to us. Next patient was a patient with a pincer nail that we debrided, so this is another low-value patient. Another one was a lesion destruction patient, wart/IPK. Next patient was, she had diabetes, bilateral bunions, and a fracture of the 3rd met. So we started with the 3rd met fracture with a cam boot. We're going to deal with the bunions and the diabetes exam in the future. Next was a Lamisil number 1 visit. Patient reviewed the sample results and got him going on the terbinafine with everything else that goes along with that, the kit. Next was an Anifix patient. I don't do a lot of Anifix, but this patient, there's some patients that have these onycholytic nails that are a little bit ingrown, and I avulse the nail and see them back in 3 months, and then I put an Anifix on there to help it to grow out a little bit normal and hopefully attached. Next patient was, she had some pain after her ingrown toenail procedure, so I saw her. That was another low-value patient. And another was a new patient. This was a patient, 38-year-old cricket player, and kind of athletic, and so we did a shockwave 1 out of 3 for his posterior tibial tendon. That's where it was hurting. He had some swelling around the posterior tibial tendon on the ultrasound. And the last one was EPAT number 5. Okay, so that was the day. I was intending to do some practice on my EMR. I ended up not doing that. I think maybe I got distracted. But what my plan is to do is each day do like 3 fake patients, like take the patients from the day and do like mock patients in my EMR just to get practice. I want to go over another thing that I kind of do. It's called an experience transformer. Once again, I go to Strategic Coach. I talked a little bit about that yesterday. It's a coaching group, and one of the ways we think about things in there is could call it like a SWOT analysis: strengths, weaknesses, opportunities, threats. But what we call it there is something called an experience transformer. So I want to go over kind of the way I evaluate my week, and this really helps me to evaluate kind of what's going on, what's working, what's not working, and then what are ways I can improve that. So I'm going to go over that. This is, I like to share kind of what's going well, what's not going well, and there's some things that are going better this week. So for my week, the good things, the evaluation, I had a coach day, and it was nice to see friends. I think by the time I've been doing this coach for about 10 years, it's less about what I'm learning and more about who's in the room. So I think there's a need for the community and a need for like a mastermind. So they give some guidance in terms of what we're working on. We're working on our businesses, we're working on ourselves, but a lot of it has to do with who's in the room and making those connections and kind of collaborating with other people in other industries. And one other thing about when you're coached or you're with other people that are kind of high-level thinkers is you don't feel guilty for talking about how successful you are or what your reach goals are and what you really want to do to improve yourself or your practice. Where I find a lot of times other people around, they really can't identify with that. I think there's fewer people around us, maybe even colleagues within podiatry, that we can share our successes with. So there's this jealousy, and you want to keep everything close to your vest. Whereas when you're in a mastermind type of a group with coaching, you're kind of all helping others out. And this group was a group that, there was a couple of sessions I did on Zoom during the pandemic, and I wouldn't have done it via Zoom. It's not, because you need to see people in the room. So this is something I would love to create, and I think the ideal thing would be having people come to like Worcester. I don't know, every quarter or something like that, with a small group meetup of people. You could try to do it Zoom. I know Zoom is easier, things like that, but it's not the same doing a Zoom. So like a meetup. Mastermind type of a group. Why Worcester? Well, it's because where I want to live and I don't want to go anywhere. Frankly, that's it. And I want to set it up with something that would be easier for me. So if you guys are interested in something like that, shoot me an email, don@podiatrypracticemastery.com. I don't know how much it would be. I just need to see mostly if there's interest in that. I'm not exactly sure how it would go. There's a couple of ways to do masterminds. It could be, we could go over our numbers. We could have a hot seat where someone goes over their issues, having a certain lecture for a portion of it. I know there's some other people that do something similar, and I've realized I have my Practice Mastery Academy, which is all online, and that's great if you're self-motivated and you're just starting out. But I think if your practice is already going at a good clip, so my sweet spot is helping people to get from like $600,000 to $700,000 up to $1 million mark. That's kind of where my sweet spot is right now, because that's where I'm living. I think if I'm trying to scale a practice, where they have 4 doctors to 20 doctors, I don't know how to do that. I don't know how to open up multiple offices, but I can help in this area. Okay, next thing is I did see a PCP with my dad. There's a geriatrician right next to my office. And it was nice to see someone else's bedside manner. I thought that was neat to see how they interact with a older patient, interacted with me. They knew that I was a big referral source, where they referred to us, but she didn't really focus on that. It was really asking a lot of questions. And I've never seen this before, but they did a whole clock where you had to put clock and times. He did okay on that, but when he was given 3 words to remember, it was... I'm trying to remember the words right now. It was like sunset, chair, and then banana. And then he came back in about 3 minutes later, asked what it was. He wasn't able to remember that. So I think his dementia is kind of progressing. But it was nice because I feel like there's more of a plan. I feel it's a little bit more under control. And we're going to be seeing a neurologist coming up soon. So this is something, it's a win because it's something that's going on. I also talked to a couple of the interns. I put an ad out for a practice rep. And some of the college students are interested in this. So I actually talked to them on the phone before we actually interviewed them. I'm enjoying that talk. I don't know how to go to the next step of actually hiring them. So this is something that usually my office manager does that, and she's really overwhelmed with this EMR transition. So I am kind of excited about hiring. I'm a little unsure of how to hire this person and how to train this person. I have a few ideas of how to do that. One other thing that I did that I have been kind of negligent recently. So usually in coach, we have this coach worksheet where we write out our goals for the quarter, If you guys want to see mine, let me know. Maybe I'll do, if you're interested, maybe I'll do a podcast on my actual goals, or the worksheet that I filled out for this quarter. But it's where you like write your goals. You write out what your largest check is, which means what would be the dream patient for me, or dream referral source. And then you also put in things that you want to fix in your practice. So if you guys are, maybe I'll do that at another podcast. That might be something that's interesting to others, just to see that. And I'm not going to go over it right now because it's going to take a little bit too long. But that was a good thing I filled it out, because in the past I've been a little negligent. I've been just so busy I don't really fill it out. But the nice thing about having that filled out is you have something to look at, and it keeps it front of mind. Whereas if it's not filled out, or if you just kind of do it what you're feeling like, you never feel like making the progress that you write on a piece of paper. So also, I said no. So this is something like health-wise. I'm trying to get down to 140. I'm currently 155. And I feel like during all this stress time, I tend to be a stress eater, even though I still try to eat just it's not once a day. I wish there were certain days where I was snacking at work, certain things. I've talked about this in the past, but this is something based on the amount of stress. I feel like I eat more, and so there's either I can work out more, or I can eat less, or I can fast less, or I can just cut out other things. So one thing that I've been working on is saying no to dessert at dinner, and setting up kind of activity intentions or eating intentions, meaning, I'm going to go to church here, and I am not going to eat this stuff. It's just not going to make me feel good after. It's hard to do. Like I struggle with it. I'm not that heavy, but it's something that is in kind of in my mind, and I tend to find that my willpower goes down in the evening time. Not so much when I'm eating dinner. What I used to do, what I used to do, is I would eat, and then a lot of times I would eat a lot of like dessert after the food. I'm eating once a day, so I justified the eating of the dessert, but I think that probably isn't a good idea, because I think it was raising my blood sugar quite a bit. So this all came after reading Peter Diamandis' book. There's a new book on like healthspan and how to like not die from dumb stuff. So it was a good book. I read. We got it at Coach. That's something that they usually give us a book a quarter as a gift. Also, I reached out to Al. Al is a guy that might be writing. So I have this podcast for Podiatry Practice Mastery. I would love to have like a weekly newsletter email go out, the same way I do for my private practice. It's just I don't have the bandwidth to do that. I prefer more doing like teaching and doing audio or presentations. So if I could have someone to take these audios and put them into a newsletter is what I'm looking to do. So I talked to him, reached out to him. I started cold showers again. I was taking a little break from that. I think once again it's willpower. I think there's a lot of research behind cold showers, and I would like to do some more. I've tried like deep breathing in the past, like what's it called? Wim Hof is his name, where he does cold shower plunges, but he also talks about deep breathing techniques. I'm not doing that much. I feel like I need something like that for stress reduction. And then also I had a couple of good workouts, and I've been dealing with some issues with our church. So I'm real involved in my church, and I've been dealing with a couple of issues with some of the youth there. So if for those that don't know, beyond this, I also take care of a church, mostly of Brazilians, and so this is what I do in the nights and weekends. This is why I don't do a lot of this stuff on the weekends. I'm pretty separate with these things. So I have that whole other obligation that I do in the evenings. So it gives me something else to do. A lot of really good value with that, but there's a lot of kind of planning and meetings and things like that with the evening time. So that was something that was good. Some bad things that happened this week. So I look at what worked, what didn't work. Like what didn't work is I had a couple poor nights of sleep. When I went to Toronto for the coaching, it was a little, I don't know if it was I didn't have my sound machine that I usually use, or it was a little hot in the room, but I find that sleep affected me. And then also at home, either hot or cold kind of affects, and I find that sleep, as I'm getting older, really affects me more and more, either cutting it out, not getting as much sleep, or having poor quality sleep. So this is something in Peter Diamandis' book about lifespan, talked about that, about like the quality of your sleep. So this is something that kind of affects me. I think your willpower goes down. You tend to eat more. You have higher cortisol levels. And so this is something that I'm realizing, so I want to kind of work on that in the future. Maybe I've considered like these cooling beds, and I don't know if I can do that when I travel. but I trying more to cut out caffeine in the afternoon. That may be affecting it as well. Okay, so anyway, and then what you do is you do what worked, what didn't work, and then what ideas for improvement or building on what's already working. So I'm going to be building on these things in this next week. Okay, hope this was beneficial to everyone. I'll try to put together and read through what I wrote out in my goals, and I think it's good. Another thing about getting together with groups like this is you can write out your goals, even if you don't. Funny thing is, even if you don't do all of them, because a lot of times you're not. It's just the act of writing them out. It kind of inspires you and brings it to front of mind. And then I tend to also find, this is something that's taken me time to realize, but a lot of my goals that I write down, it's not going to happen for a number of quarters. Meaning I write it down one quarter, then again, and then finally it happens. Things like my scribe, things like this practice rep. These are things that have been on my radar for a long time, and sometimes it just takes time for these things to come to fruition. So you have to be more patient with these changes. Changes are hard because we're all busy. To add something new to your agenda is kind of a challenge. Okay, thanks guys. Hope you enjoyed this.